Father Emmanuel, how are you?
Thank God, all is good, John. Really happy to join you on your show.
Yeah, thank God. So I wanted to have a conversation with you about some current events within the Orthodox world and Christianity at large, because you are very bold with your channel and the things that you discuss. You do not shy away from difficult topics. So for people who are unfamiliar with you and what you do, would you mind giving a brief introduction to who Father Emmanuel is?
Yeah, sure. So I'm a Greek Orthodox priest, although I was assigned to the Albanian diocese under the Ecumenical Patriarchate upon my ordination. I was ordained in 2011, July. I've served parishes mostly in New England in the United States, but also I've served in Hong Kong, in Constantinople, in Switzerland, in Greece, around the world, in Italy. So I've been fortunate to see Orthodoxy around the world in its many diverse and beautiful manifestations. And I also have a lay vocation in finance, or I have had a lay vocation in finance. I've also been a writer, and now I maintain a podcast with my presbytera, Theodora.
Awesome. Okay, so now I'm curious. What has it been like being all over the world and compared to being in America? Did you grow up in America or?
No, I grew up sort of all over the world. I
Okay.
went back and forth to Greece a lot as a child. My mother's Greek. So I think the first time we went there, I must have been 5 or 6 years old, and then we would stay for years at a time and then come back. And really was a chance to see two different worlds. And then I went to high school in Germany, and yeah, it was quite an experience growing up that way and seeing really living in an Orthodox country, but not really understanding the meaning of that as a child. You know, the sort of ancient faith that has lived in Greece for 2,000 years. To be in the places where St. Paul walked and established communities. Um, in hindsight, it must have been God's design.
Yeah, one of the things that drew me to your work was I heard your interview on Buck Johnson's show on Counterflow. Um, I feel like that's gonna become like a meme on my channel. How many times I reference Counterflow because it's happened at least twice now, so there's a trend. But one of the things that you were talking about on that episode was your former battle with pharma, and would you want to give a little bit of an overview for people? I'm sure, if they want to hear the full story, they can go to your channel or listen to that interview for more. But just as a basic overview, what was that about for you?
Yeah, I can understand why you reference Buck's show. Buck's a great guy. It's really great joining his podcast, and it started in 2014. I was really very interested in the academic side of security analysis, so analyzing financial statements. I just found the academic side so interesting, and I went on to publish several hundred articles, believe it or not, on the psychology of capital allocation and security analysis. And eventually, I had come across this company, Ligand Pharmaceuticals, and none of their accounting made sense. And the further I went down this rabbit hole of trying to understand why their financials didn't add up, the more just one thing led to another. And I eventually came to understand that the company really was engaged in fraud. And so, as a fiduciary myself, I felt that I had a moral, a civic responsibility, a fiduciary responsibility to reveal that fraud. And then, as I did that, increasingly, I went on to publish 56 pages of reports to reveal this company and what they were engaged in. It just led me again down this rabbit hole that led to their licensees, which was Novartis, one of the biggest pharmaceutical companies in the world. I think they're in the top three, and their practices, what they were doing. And they didn't like that very much. So they set out to, quote unquote, silence me for good. And that led to an 11-year legal battle between me and the US government because they ultimately co opted the Securities and Exchange Commission to try to silence me.
Wow.
It actually became an unbelievable story. I mean, you read the story, and we've got a brief history of it on our website, lemelsohncapital.com, under the About Us section. And there's a 2-part podcast series we did. I think it's episodes 29, part 1 and 2. But that just scratches the surface. We have a blog, Mvona, where you can read more. We have a presentation there. We eventually went to the Supreme Court. Mike Pence joined our legal team. 27 other organizations, national organizations, joined the fight. And I think they just thought we're going to, roll this priest. And but I couldn't walk away from the fight either, just because when I saw what these companies were doing, how they were preying on the sick and the dying, I would go to the hospital sometimes after church, and I would bring Holy Communion to the sick and the dying, or I would go to pray for those who wanted good health or to recover from sickness. And I thought, these people see the vulnerable as a source of profit. They see them as those who can be easily exploited. And I guess I took it personally. And so, I really got an insight into the corruption of our government. There's what you can say are captured regulators, where these regulatory agencies that you think are involved in a certain activity, like the United States Securities and Exchange Commission, you would think is involved in the activity of policing markets, but they're highly corrupt. They're captured by special interests like the pharmaceutical industry, so they will employ former high-ranking officials in those organizations in private practice when they leave to make sure they get the results they want, including getting rid of their critics. And that's what I was caught up in. I'm still caught up in it, believe it or not. I'm going to my 11th year soon. We've won one battle after another, and we had a 2021 trial where we basically prevailed against all of their fraud allegations, which are completely fabricated. They were, in fact, the fraudulent allegations. And then I guess they couldn't handle losing to a priest, so they considered to continue to pursue me. Broke all sorts of laws to do that, and it's just gotten to be a bigger and bigger and bigger case. It's made all sorts of headlines all over the world. Yeah.
Wow.
The company went on to lose $5 billion in market cap. Their stock collapsed. Their CEO resigned. Corrupt congressman that was behind it got sentenced to 11 months in prison. And the man that was critical to it, who was behind making it all happen, his name's Brad Bondi. He's actually the brother of our sitting attorney general. So he's, when you hear about a deep state and you hear about sort of the tentacles of the deep state or the administrative state, this is what I call shadow lawyers who are in the background. You don't really see them too much. You see Pam Bondi a lot, but you don't see sort of like the Brad Bondis of the world, and the way they're able to sort of pull the strings. The people you see are, again, the front, the leading figures in politics, but there's these shadow lawyers in the background. They're almost always lawyers, and they're really the ones who are always there. They don't have a political ideology. They're not conservative or liberal. They don't really care about any particular issue. Their God is actually just money and power. And they'll pretty much do anything to get more of those two things.
Yeah, so I think I mentioned to you previously, I used to work at Children's Health Defense, so I was familiar with, a lot of the things that you cover, but also I'm very much a student. I don't know everything, and there's a lot of just the more I learn, I feel like there are a lot of people in the church who are aware of the corruption within the pharmaceutical industry, and
they'll kill for profit. I always say that. That's not hyperbole either.
For sure. Yeah. So I think this is kind of a thing that is in the cultural ether, and especially in the Orthodox Church, because people are asking these types of questions. This is not an episode predominantly about like the corruption of big pharma. Like, I feel like everybody knows that, and if they don't know that, there's a lot of better resources that they can go find. That I don't want to get too into the weeds for the purposes of this conversation, but for a lot of people who have come to this conclusion, how do you rebuild something from that? Because I think I've met a lot of like-minded people who are into alternative health, but it's kind of the Wild West right now, and we don't really have this formulated system. So in the wake of 2020 and all these things that have happened, and the corruption that exists within pharma, as a priest, as that these things, how do you recommend that we as Orthodox Christians approach health?
Yeah, that's a really, really good question, John. We have to pray for good health. The body is sacred. We don't reject, as Orthodox, we don't reject modern medicine, but we have to be aware of corruption in the world, that such thing is evil. We've seen it time and time again in the pharmaceutical industry, for example. And, if we have a patron saint of physicians, for example, St. Panteleimon, and we fast as Orthodox Christians, right? We control what we put into our bodies. St. John Chrysostom would say, just eat enough to, stifle your hunger. if we look at what's going on in America as a society and a culture, we're so unhealthy physically, but we're also unhealthy spiritually. And we can see it visually in this, if you look at photographs of Americans in the 1950s or 40s or 60s, we look physically different now because we're not very disciplined with how we consume. We consume without limit, and we consume things that are harmful to us. And first, I think it begins with that. What are we eating and how do we eat? So we have to eat healthy, eat things that are made the way God gave them to us. Now, I'm not always great at that. Anyone who knows me will tell you that. But as you that, my priest tells us all the time: look for things that are not processed, that are the way God made them. You look at the monks on Mount Athos, for example; they have such little incidence of high blood pressure or heart disease or any of these things. And then we understand and believe in our faith that we are psychosomatic beings. So our spiritual health, our emotional health affects our physical health. So to the extent we live in a very high stress society, or we work extremely long hours, that's not healthy, this could certainly affect our physical well-being. And then when we do encounter physical ailments, I think we need to look at them as opportunities to draw closer to God and for our spiritual growth. So if the goal is the salvation of our soul, we have to see everything as a gift from God. We have to see even our ailments as a way to not be bitter about what has happened to us, but rather to say, this is an opportunity that God has allowed to happen so that I might draw nearer to him. And then in terms of understanding physical sickness, we can minister to the sick, as we see in the example, for example, of the Samaritan, the Good Samaritan. We see others who are suffering, we can be compassionate towards them. So all of these issues of sickness can be seen through the lens of Orthodox Christianity, through the lens of our faith, and not just seen as necessarily black or white. Obviously, in my view, the pharmaceutical industry specifically, because we started talking about that, is corrupted. It's not like it used to be, where it's maybe doctors who are meaning well get together and say we have to cure a disease or find discover insulin or something that's going to help humanity. It's when it's purely a financial endeavor, when it comes down to how can we maximize and exploit profits from everything we do, it's corrupted. And I think the only way to fix that, to fix medicine, to fix the medical system, is to have doctors and scientists and researchers who are grounded in faith, quite frankly. Because without that, there's just all sorts of doors open to the devil to get involved. Like psychology. If you look at psychologists who are not grounded in faith, they don't help their patients, their clients, their whoever. They're trying. They just want to talk in circles. So psychology, medicine, science, all these things, when it's not grounded in faith, it runs the risk of becoming, for lack of a better word, bastardized by capitalism. And that's where we're at in America right now. We've got capitalism's gone off the rails. I'm a capitalist, don't get me wrong. I think it's the best of all the different systems that are available to us. It's not perfect. But when it gets out of control as it is now, you get a situation like we're in.
Right. And there's also scripture about how a lot of sickness is caused by sin. And that's not something that people immediately go to when it comes to physical ailments. They immediately just go to the doctor. But as you're mentioning, like, there is a much broader approach to things that affect our health, and it's not always just a physiological thing. And I think that's
right.
what our current medical system has done, is like dialed it down and specialized. Like, you only have like an issue in your right leg, and you're gonna go to a right leg doctor, basically, and they're not gonna look at anything else, So it's asinine to think that way, because we're fully connected beings.
Absolutely. In fact, when you go to Greece, for example, when you go into the churches, you don't see this practice in America so much, but you see the icons, and they have these little silver plates that they hang around the icons, and one will have an image of a leg or an arm or whatever ailment someone's suffering from. And this idea that we do believe in miracles, that we do believe in the healing of body and soul. And I should have added also that as we think about our healing, we turn to the church and her sacraments, as the service of Evangelion, of Holy Unction in the Orthodox Church, to receive frequently of the precious body and blood of Christ. I remember once I was at this parish in Massachusetts where I served as a seminarian, And the priest there, he was a wonderful man. I have to tell you the story now that I'm thinking about it. His name was Father Emmanuel Metaxas. Many people knew him. He was quite beloved. And there's two stories he told me. Actually, one he told me, one that another sexton in the altar told me. And the sexton, he was an alcoholic, which is an ailment, right? It's an addiction. It destroys your life, and it destroys you physically as well. It destroys your liver and so forth. And as he was trying to stop drinking, the priest told him, he said, every day he would say, bring andidaron home, the blessed bread from church, and put it in the refrigerator, and every day have just a little bit of that to fill you, the blessed bread from church, instead of the alcohol, so that you feel satisfied and filled, and put your attention on that. And this man, he told me this story about how in time, when he adopted this practice, he stopped drinking. And now that's very hard. Any late stage alcoholic will tell you, you just go to an AA meeting. That's a mean feat to overcome alcoholism. But again, it was through the practice of the church. And again, what are we putting in our mouth? What are we consuming? And then the other story that Father Emmanuel Metaxas told me, and I'll just never forget it. He said, his father was also a priest. He said he was a priest in the hospital in Greece. And when I go to Greece, I have a close friend who serves at the hospital in Athens. And no matter what time my flight arrives, he picks me up and he says, we're going straight to the hospital. I said, great. And we go and we see the sick and we give them Holy Communion. But he said, my father would go to the hospital and he would give Holy Communion to the sick patients at the hospital, and they would line up to receive Holy Communion. He said, and he would tell me to go to the back of the line. His father would tell him that when he was a little boy. And he told the story in great detail. And at the very end, he said this to me. He said, and it wasn't just a hospital, but he was ministering to patients in the infectious disease ward. Now imagine the faith of that man. He put his own son at the back of the line of patients in the infectious disease ward. Now think about that faith, that practice, in Greek it's praxis, yeah, of the Orthodox faith, versus what we encountered during the pandemic with plastic spoons and changing the chalice and masks and churches shut down and so forth. Did the infectious disease change? Was it worse than the other one? Or did our faith change? So when you go to a country like Greece that has this rich ancient faith for 2,000 years, Orthodoxy is, we can say, modern in America. It's relatively new. It just hasn't had much time to establish itself. And you see the faithful and how they live their faith and how that relates to their sense of well-being, physical well-being. We have a lot to learn from countries like Greece, and where Orthodoxy has existed for 2 millennia. And that story just always stuck out with me. Those two stories, actually, the one about the man who was cured, so to speak, of his alcoholism, and the priest who, as a young boy, would receive Holy Communion at the back of the line in the infectious disease ward. So our faith needs to go beyond just, we call the doctor. Yes, we can call the doctor. We should believe in modern medicine. We shouldn't become like this movements we see in Germany, for example, where they have this new age medicine, which is it's wacky at some point. But at the same time, we are really our sense of understanding of health and of cure is rooted in our faith in God, first and foremost.
Right. I, fortunately or unfortunately, came into the church shortly after COVID. So I was not privy to the things that happened, but I've heard legends. So yeah, I'll leave it at that.
God's time's perfect, John. So the time you came was the right time.